Mrashebidweni owo dwaboso ono so ene sentrefo kasa kire se anka ebeya anka aban sa technical advisory team wo mo hwe se COVID-19 wo mo bekono anka yentwitwam esan se wo mo adwuma wo ye ne nyina kire se ase COVID-19 no ya age wo mo nsem afa suku aye bie no nso PPEs ne nkoye ito munye bibi mfa ho.
Ladies and gentlemen, since the outbreak of this pandemic, government has not shown competence in the management of the virus. The first 2 cases of COVID-19 in Ghana were reported in March 2020. This was after government failed to be proactive in closing our borders early. Since then, Ghana's confirmed cases has increased exponentially to 72,328 as of 8 February this year, and records more than 700 newly confirmed cases daily, with current active cases of 6,707. At the last count, Ghana has lost 464 lives to the virus as of yesterday, with about 129 or 28% of these deaths occurring only this year. The trend of infections and deaths is worrying, and if nothing is done immediately to arrest the situation, our attempt with COVID world would be a complete disaster. Also, with the discovery of the new variant of COVID-19 in Ghana, one would expect that experienced frontline health professionals will be deployed to man our COVID-19 health centers, but sadly, this is not the case, simply because government has reneged on its promise to pay some front health care professionals their 50% allowances and the insurance packages for those who get infected or die in the line of duty. Public health facilities are collapsing under heavy financial constraints due to lack of adequate subventions from government to finance the procurement of goods and services. We hear of no PPEs, no oxygen for patients desperately in need of oxygen. To make matters worse, schools have reopened without taking full deliveries of PPEs, and there has been little or no engagement with parents, teachers, and other stakeholders on how to manage the schools, all leading to outbreak of infections in some senior high schools across the country. Government should, as a matter of urgency, dissolve the technical advisory team formed in 2020 and recompose a technical team that is multidisciplinary and non-partisan, competent enough to direct on the management of COVID-19 in the country. With the upsurge in COVID-19 cases in Ghana, we urge government to show seriousness, evaluate and review the management of the pandemic in this country.